So those are just a couple of ways to look at the quantum entanglement, or the ways to influence the healing aspect of the TMJ. So a massage therapist, a great dentist, but also understanding not only the structural aspect that can be alleviated with the night guard, but also the chemical aspect of massage, diet, and meditation, and all of those other modalities to pretty much help you have a better smile.
I'm learning that through visualization too. I tell my patients, just close your eyes for 21 days at night and visualize yourself and think that you are not grinding your teeth, that your jaw is aligned. And one of the things that I'm gonna ask him before he gave me some exercises is he has the space, because he's also my patient, for the wisdom teeth. But not a lot of patients have a space, and unfortunately they have to extract the 4 wisdom teeth to make a space on the jaw, because they're, depending on the race, they are races that have a very small, the head is very small and they don't have enough space for all the teeth. So they have to take the teeth out so when they do braces, they can fit and they have more space. Some other patients are not able to clean and floss or brush the teeth, so they have to be extracted, because it's not easy to restore a tooth. It's a wisdom tooth, and it's not easy to do a root canal. That's why he's lucky, because he's able to do that. He's excellent in his cleaning technique of his mouth, but not every patient can do it. So don't get confused when he said don't take the wisdom teeth out. It's better to don't take any tooth out. But the wisdom teeth, when they don't have a space, the patient, the orthodontist is going to ask you to take them out, and that is unfortunately, then is when you look at other ways to fix your temporomandibular jaw if you have a problem. But if just to finish this episode, do you recommend other exercise other than the techniques that some of the dentists recommend to push hair, or any type of massage that in the morning they wake up with a lot of pain on the jaw in this area, that actually can induce to a migraine or to a headache? And even the muscles that are very tense, we're going to talk about refer pain in following episodes, because the pain of the muscles can mimic a root canal treatment, and it's not a root canal treatment. Imagine the pressure the muscles put in your teeth, and you're going to have pain in several teeth. And just to close quickly the episode, because we're running longer, do you recommend any other exercises the patient can do on massaging themselves in the morning, if they cannot see you as a massage therapist, or they don't find anybody or somebody that is trained in that area?
The key is strengthening the jaw. So any type of strengthening exercises in the morning, when you wake up.
And you go, ow.
Indeed. So I've been trained as an entertainer for over the past, say, 15, 20 years. And so with a lot of, before performing, we have exercises to do. Vocal training, we do, so your lateral and your medial pterygoids are responsible for all of that shifting. Your masseter is responsible for chewing. Your temporalis is mainly for, so when you do that whole 360 degree, do some exercise. This is kind of like stretching. But then also chew on nuts, chew on a variety of different, like wood.
No wood, because you can fracture your tooth.
Old ancestors, they used to have chew sticks. Chew sticks pretty much help you. They work better than guards because they're more organic. And so with the chew sticks, you're able to kind of be able to naturally play with your juices and get a better harmony of the saliva and everything when it comes to just strengthening, because that basically you strengthen all of the muscles all around the jaw, and then basically you won't probably hurt yourself as much because you can play around with it on your tongue. And also the bark, just like with microtubules. So trees have what's called bark, and the bark is the microtubules of the tree. So when that bark and the orifice of the mouth communicates, it's a very harmonious relationship, and that's what quantum healing is about. It's about pretty much not interrupting the quantum healing aspect of the anatomy and physiology. And so strengthening, visualization, in the morning, just like you said, open the mouth up, before you eat anything, stretch the muscles out. Your platysmal muscle, which stretches from here, you see that ugly muscle right there? You can do a lot of stretches with that muscle. And so you can also do massages on your temporalis, right in here. But then you have to get real comfortable with pressure application. Also, you can do massages on what's called your sternocleidomastoid muscle, right in here. And when you get in here, you can really complement this aspect, but what we call the posterior aspect, all in here, and go around into your what's called your occipital muscles. So between your occipital muscles and all into your frontal aspect, between those two. But also I will also say at night, probably tea, chamomile, because that'll help induce melatonin and mental parasympathetic systemic responses as well.
Thank you very much. I laugh when my producer said you have to relax and move the head and I didn't think it was important, but a lot of us stretch for our body and we forget to stretch for our mouth. So you can also look around, look at his channel, and if you have any questions, again, Dr. Ramon Payne, thank you very much. And Dr. Fanny Yacaman, again, with another interesting topic that you can learn something about it. If you have any questions, don't forget to send me a message through YouTube or Instagram or TikTok. Take care, and I see you in the next episode. Bye-bye.